Hello, welcome to our webinar today. We're going to be getting started in just a few moments. Before we get started with the webinar, I'd love to tell you about some upcoming events and webinars that we have coming up here. On Wednesday, September 21st, we're going to be having a free webinar called Please Stop Interrupting Me with Deborah A. Bonham-Davis, PhD, CHFP. And this webinar will be live only. We will not be recording that session. So make sure to tune in and join us on Wednesday, September 21st. The following Wednesday, September 28th, we'll be having a free webinar in partnership with the California Labor Lab and Dr. Paul Blanc from UC San Francisco. And the topic is Past as Prologue, How the History of Occupational Illness and Injury Teaches Us About Where We Are Today. And as we round into October, on Wednesday, October 5th, we will be having a free webinar on trends in environmental health, learning from our past, bettering our future, with Michelle Bell, PhD. And our next industrial hygiene webinar is going to be on Tuesday, October 11th, with the Northern California Education and Research Center for Occupational and Environmental Health and Patton Nukin. And the topic will be fine particulate matter exposure from cannabis bong smoking. And for more, you can learn about these upcoming events and register at cueh@berkeley.edu/about-CE. And without further ado, it is my pleasure to welcome you to today's event. On behalf of education and research centers throughout the country, we're pleased to present the Industrial Hygiene webinar series. This is a collaborative effort on behalf of each ERC's continuing education program and aspires to provide you with access to the current research supported through NIOSH ERC programs. Thank you for being here today. Today's webinar, Understanding COVID-19 Among Industrial Livestock Operation Workers, Salivary Biomarkers and Mixed Method Approaches, is brought to you by the Johns Hopkins Education and Research Center for Occupational Safety and Health. A few housekeeping items before we get started. You're going to be muted during the presentation. If you'd like to ask a question, you can enter it into the Q&A, and we'll save time at the end of the presentation to address as many questions as possible. We do ask that you enter the questions into the Q&A as opposed to the chat. That just helps me keep better track of it towards the end of the session. Make sure that we get your questions answered. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page. And all participants who log in today with their registration email for the full live presentation will get a link to the evaluation form that will qualify you for a certificate of completion with 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. I'll be putting that link in the chat at the end of the webinar today, and that'll also be sent to you automatically from Zoom at noon tomorrow. And without further ado, it's my pleasure to introduce our presentation and our presenter for today. And we're joined by Carolyn Gigot. Carolyn is a 4th-year PhD candidate in environmental health at the Johns Hopkins Bloomberg School of Public Health. She's interested in mixed methods and spatial analysis for exposure and risk assessment. Before beginning her PhD, she worked for the U.S. Environmental Protection Agency as an ORAU contractor, contributing to chemical health hazard assessments and supporting the integration of additional systemic review tools and methods. She received her bachelor's degree in organismic and evolutionary biology with a secondary field in earth and planetary sciences from Harvard University in 2016. Thank you so much for joining us today. Looking forward to the presentation.
Thank you for that introduction. And thank you everyone who's attending today. Today I'm going to talk about my thesis research on COVID-19 among industrial livestock operation workers using salivary biomarkers and mixed methods approaches. So an outline of what I'm going to talk about today. First, some background on health risks associated with industrial livestock operation work, both production and processing, and COVID-19, especially among industrial livestock operation workers, again, both production and processing. And then I'm going to talk about my work, part of an ongoing cohort study led by Dr. Chris Heaney in collaboration with the North Carolina community organization REACH. I'm going to talk about 3 pieces of this project. First, salivary biomarkers, both diagnostic testing for COVID-19 and antibody testing for an infection-specific response. Second, some of what we've learned so far from the questionnaires participants have completed, and then some of what we've learned so far from interviews with workers. So to start off, this table compares the number of workers, rates of injury and illness, and average weekly wage of livestock industry workers compared to US workers as a whole. Occupational surveillance in livestock industry work can be challenging due to a lot of reporting exemptions and other factors that have been shown to result in injury and illness undercounts. Even with those suspected undercounts, animal slaughtering and processing workers had more than twice the rate of injury and illness compared to all US workers. And animal production workers had close to twice the rate of injury and illness compared to all US workers, according to the 2020 Bureau of Labor Statistics survey of occupational illness and injury. And I'd also like to note that all of these workers' average weekly wages are less than the national average. In this presentation, I'm going to focus on poultry and hog production and processing because those are the main industries in our study area. Over the last several decades, both the hog and poultry industries have shifted to larger, more specialized operations linked by contracts across stages of production and processing. And production operations that concentrate animals are also concentrating animal waste and all of the associated pollutants, including hydrogen sulfide, ammonia, a wide range of volatile organic compounds, particulate matter, endotoxin from bacteria, dust, and livestock-associated viruses, bacteria, and fungi, including many antimicrobial resistant strains. And these contaminants and unsanitary conditions have been connected to elevated risks of respiratory and infectious disease among hog and poultry production workers. Zoonotic infections related to close contact with animals and animal waste are a major concern. Needles are used to vaccinate, give medications, and draw blood from animals, and a needle stick injury can happen and expose workers to infection or to medications intended for the animals that could cause adverse health effects. Then the main contributors to injuries are accidents with machinery and accidents with animals. And again, these high animal density conditions are potentially increasing the hazards to workers, especially related to accidents with animals. Kicks, bites, being pinned between animals are all pretty well documented. And then noise from both animals and equipment and extreme temperatures are also concerns for worker health. Then processing workers are also exposed to animal waste and associated microbial hazards, again, including some which are antibiotic resistant, as well as other chemical hazards, including ammonia, which is used for refrigeration, and disinfectants like chlorine and hydrogen peroxide. And these workers also then face the associated risks of skin, respiratory, and infectious disease. Processing workers also use sharp tools and heavy machinery, often at high speeds, and accordingly face higher risk of acute and repetitive stress injuries. Meatpacking workers also are exposed to more crowded and potentially unsanitary working conditions, working long shifts in enclosed facilities with hundreds of thousands or thousands of other workers and few breaks. And then when workers do get breaks, these are also often crowded and in small common areas. And hog and poultry production and processing have also been associated with a range of health risks to nearby community residents, including respiratory health hazards and the dispersal of infectious disease. The General Duty Clause from the Occupational Safety and Health Act of 1970 requires that all employers provide a work environment free from recognized hazards that are causing or are likely to cause death or serious physical harm. And then the other federal Occupational Safety and Health Administration legal standards that would apply to industrial livestock operations are first, those just related to general industry, requiring that employers provide adequate personal protective equipment, safety training, and a workplace that is clean, orderly, and sanitary. And then the agriculture standards also apply, including requirements for rollover protective structures on tractors, employee operating instructions for tractors and machinery, guarding of farm equipment, to try to prevent injury, and general sanitation and environmental controls. Next, I'm going to talk a little more about COVID-19 and the livestock industry. COVID-19 remains a leading cause of death, even now, more than 2 years after the first confirmed case in the US. In 2020 and in 2021, COVID was the third leading cause of death in the US, second only to heart disease and cancer. And there is evidence that COVID-19 has disproportionately affected industrial livestock operation workers, rural communities, and racial and ethnic minorities in the US. And these are, all overlapping categories. Meat processing operations emerged early in the course of the pandemic as centers of COVID-19 outbreaks. I'm sure you all remember news coverage describing high numbers of cases among meat processing workers, and a CDC mortality and morbidity weekly report identified pretty early on, through May 2020, more than 10,000 cases associated with meat and poultry processing work. Then the nonprofit Food and Environment Reporting Network did a lot of work tracking cases associated with the food industry and identified more than 22,000 cases associated with the industry. Even this, though, is an undercount. The House Select Subcommittee on the Coronavirus Crisis obtained data from just the 5 largest meatpacking companies, not the whole industry, in fall 2021, which described at least 59,000 cases during the first year of the pandemic, substantially higher than previously estimated. And the left column is the number of cases originally estimated and then estimated by Fern and then company reported as requested by the House Select Subcommittee 2021. And even these higher numbers are likely still an underestimate because some of the companies excluded offsite testing or employee self-reported cases. The House Select Subcommittee report also included evidence that COVID disproportionately impacted minority meatpacking workers. More meat and poultry processing workers are racial or ethnic minorities compared to the general worker population in the US. About 44% of meatpacking workers are Hispanic or Latino, about 25% Black, and that's compared to about 16% Hispanic Latino in the general US workforce and about 12% Black in the general US workforce. And the CDC report on cases through May 2020 found that 87% of infected meat and poultry processing workers were racial or ethnic minorities, which is an even higher proportion than the proportion of racial or ethnic minorities in the workforce. And white workers made up 39% of the workforce, but only 13% of cases. So this is to say that this kind of work may be part of why racial and ethnic minorities in the US are disproportionately affected. But then even within this workforce, those groups are facing a higher burden of disease. Meatpacking plants have also been connected to the spread of COVID-19 in nearby communities. This figure is from a 2021 analysis that shows COVID-19 cases per capita in large meatpacking, the dotted lines, versus non-meatpacking counties, the straight line. And this is kind of just a back of the envelope kind of analysis, but even after accounting for some county level demographic information, the authors found that chicken, pork, and beef processing facilities were all connected with high COVID transmission, especially initially. And a 2020 analysis by Taylor et al. Found the same trend, disproportionate numbers of cases connecting to meatpacking plants. For example, in Kansas, 14% of cases had been linked at that time to meatpacking plants, even though only 0.6% of the population works in that industry. Some more background. Again, you've probably seen this inverted pyramid before. This is the hierarchy of workplace safety controls from generally most protective, eliminating the hazard, through substitution, engineering controls, administrative controls, and to generally least protective, personal protective equipment. And this is a framework that I think is a good way to think about and evaluate workplace safety and health strategies. This figure is from a rapid response online survey of Midwestern meatpacking workers in May 2020. More than 70% of whom believe they're at high risk. They were at high risk for contracting COVID, but only 42% of whom had been tested. On the x-axis are COVID interventions that their employers may have put in place, and the y-axis, the percent of workers surveyed, reporting that those were in place at their place of work. And I think it's helpful to think about these using that hierarchy of controls. So most workers reported that their employer had instituted some safety measures, and one of the most frequent was requiring everyone to wear masks, which is the lowest rung of the hierarchy of controls. Then some administrative controls were pretty frequently reported, engineering controls less so, and then controls that seek to eliminate COVID exposure at work by providing paid time off and restructuring shifts, I assume, to have less people at the same time, working at the same time, were not reported frequently at all. And then some of these changes, I don't think even fit in the hierarchy of controls at all. And then installing plastic barriers has been shown to reduce airflow and ventilation, and paid attendance bonuses. I mean, I would expect this even almost to be harmful. So despite many calls from labor groups, lawmakers, and experts, OSHA did not issue an emergency temporary standard, which would have provided an enforceable regulatory standard needs to take some of those higher up steps on the hierarchy of controls to protect workers. Without an ETS, OSHA could only enforce the general duty clause to try to make conditions safer in the context of COVID. And this can be more difficult to show than the elements of proof required for violation of a hazard specific standard. And this is borne out by the fact that despite receiving hundreds of complaints, OSHA issued only 9 citations to 3 meatpacking companies with severe COVID outbreaks in 2020. OSHA also actually carried out fewer inspections in 2020 compared to 2019, relying on reporting by employers to decide whether or not to proceed with the case. And I've been talking mostly about meat processing workers, but COVID-19 has also affected production workers, and there is reason to believe that animal production workplaces could also be a site for the spread of the disease. This is the Food and Environment Reporting Network, again, data here. They track cases throughout the food industry. And as I mentioned before, this is almost certainly an underestimate for the meatpacking data, this red line. But this blue line does also show high number of cases among farmers, and the green line, high numbers of cases across food sectors. And this timeline is just to give a summary and organize some of the events I've talked about in time. The blue line is the number of new confirmed COVID-19 cases in the US. So you can see the spread of the disease in winter and spring 2020. The Trump White House issued an executive order keeping meat processing plants open in April 2020. Then you can see increasing numbers of new cases per day. The FDA issued emergency use authorizations for the Pfizer and Moderna mRNA vaccines in December 2020, and the J&J one-dose vaccine in February 2021. That winter is also when the first OSHA COVID-19 guidance was posted, not legally enforceable mandatory OSHA standards, but recommendations. In spring 2021, the more transmissible Delta variant of the SARS-CoV-2 virus that causes COVID-19 emerged in the US, quickly became the dominant variant. Then in June 2021, OSHA did issue an emergency temporary standard, but for healthcare workers only. In November 2021, the Biden administration announced a broader vaccination or testing mandate for all people who work for employers with more than 100 employees. That was set to take effect January 4, 2022, but was blocked by a Supreme Court ruling in January 2022. Later in November, the CDC began to recommend a COVID vaccine booster dose for all adults. And then the WHO also announced the more transmissible Omicron variant as a variant of concern in November 2021. And you can see pretty high numbers of new cases through September 2022, despite availability of vaccines in the US and more therapeutics available. Now I'm going to talk about the ongoing research study that includes my dissertation research, COVID-19 and microbial exposures among industrial livestock operation workers and community residents in North Carolina, USA. So about our study setting, North Carolina has experienced 3.1 million PCR confirmed COVID-19 cases, 7th most of the 50 states, and 26,000 deaths attributed to COVID-19, 13th most of the 50 states as of early September. North Carolina also has a large livestock industry and is the second leading hog and turkey and 5th leading broiler chicken producing state as of 2021. And I'm working on this project with Chris Heaney's research group at Johns Hopkins and the Carolina community organization REACH, located at this blue star in a high intensity industrial livestock production part of the state. REACH has collaborated with Johns Hopkins and with UNC on several projects over the years, studying adverse health effects of industrial farming operations, and their community organizers helped develop this research, as well as recruiting almost all our participants and collecting data. A little more background. You're all probably aware of the different kinds of COVID tests, but to be clear, that there are two main categories that answer two different questions. Diagnostic tests test whether a person is currently infected with SARS-CoV-2, the virus that causes COVID-19, and antibody or serology tests test whether a person's immune system produced antibodies against that virus. Of the diagnostic tests, molecular or nucleic acid tests identify SARS-CoV-2 RNA and are usually more accurate and more sensitive, but need to be processed in a lab. Antigen tests identify proteins on the virus and are usually less accurate and less sensitive, but this is more of the rapid tests. And then each of these tests can be done in a different matrix. For our study, we had one of each category of tests to answer each question, and we used saliva as the matrix for both because we were initially rolling out the study remotely, and just a saliva sample facilitated remote, non-invasive sample collection that participants could do themselves on a call with a researcher. We recruited 279 participants living in North Carolina who could answer questions in English or Spanish through snowball sampling, primarily by our community partner group, REACH, and over a longer recruitment period than we had planned. The study follows three groups of people. First, workers at hog or poultry production operations or meat packing or animal rendering operations and their household members, this ILO group. Second, people who live in high intensity livestock operation areas, but who do not work at any of those operations, ILO neighbor. And third, a kind of control group of people living in metropolitan North Carolina without occupational livestock exposure. And the goal is to create a cohort of people with a range of exposures to industrial livestock operations from occupation and proximity. Some environmental exposure routes could include pig truck routes, water runoff, transmission by air, and the contaminants of concern in the study are not only COVID transmitted between people, but pig and poultry associated bacteria and viruses and air pollution that would be more transmitted through those environmental routes. And at baseline, we had all participants complete a questionnaire and those two COVID tests. We followed the industrial livestock operation, workers and their household members weekly over time. And we're in the process of conducting interviews, more in-depth, semi-structured interviews just with workers. Again, this is that timeline. And here's our enrollment period in red. This is a subset of our table 1, the cohort demographic characteristics by study group. Participants were a range of ages, pretty similar across groups. Our metro group had more female participants. The majority of our participants were Black, but a significant proportion were Hispanic or Latino. and a significant proportion, especially of our ILO group, had a high school education or less. And a third to a half of our participants were had completed the primary vaccination series by the time they were enrolled. Our diagnostic testing and our antibody serology testing showed exposures to SARS-CoV-2 in our cohort, and our antibody testing showed higher exposures in our industrial livestock operation household group compared to the rest of our cohorts, and also compared to other cohorts in the area sampled over the same time period. So this figure shows participant PCR tests over time. We sampled 41 industrial livestock operation household participants and collected 305 samples total. 76 industrial livestock operation neighbor individuals and 42 metro individuals, and only one participant tested positive. They tested positive 4 times at visits 11, 12, 14, and 16, and this is an industrial hog operation worker, a truck driver, not vaccinated. Antibody or serology tests, again, measure antibodies in the blood against specific infections and can be used to estimate how many people have been infected with a particular pathogen. My advisor, Dr. Chris Heaney's group, showed that SARS-CoV-2 specific IgG antibody response in saliva reflects that in blood serum and identifies confirmed cases versus pre-COVID samples with high sensitivity and specificity. SARS-CoV-2 antibody response can also be used to estimate trends in infection versus vaccination to some extent. Infection produces a response against this nucleocapsid N protein and spike S protein. Vaccination with the mRNA vaccines, Pfizer and Moderna, as well as the J&J vaccine, results in production. It's targeted at the spike S, including its receptor binding domain, RBD protein. And so an N response is indicative of recent or past infection. And so here's the infection-induced N antibody results. Black for negative, red for positive. And then here, just from the baseline visit, for better comparison between the groups, at that baseline visit, 63% of ILO participants had infection-induced antibodies, which is higher than the ILO neighbor group and metro group. But as you can see, our long enrollment period makes comparing these groups difficult. This table shows the antibody test results, the date range, sampling date range, and then the prevalence ratio of each of the groups compared to the industrial livestock operation household group in our cohort. And that's from a binomial regression with a logit link. And you can see, ILO group had 1.3 times the prevalence of infection-induced antibodies compared to other ILO N and metro participants. Then here's the same comparison with 2 other Southern US cohorts at overlapping time periods. Dr. Heaney's group also worked on a study of antibody prevalence among Atlanta healthcare workers. And I think this is a good comparison because it's another high-risk occupational group, and it's also the same assay. And the prevalence among our ILO group was almost 2.5 times that in this other high-risk occupation cohort. Then we also corresponded with researchers doing another North Carolina seroprevalence study, which was a general population-based study with repeated measures monthly. And then shown here, Cabarrus County, this is the lowest and highest seroprevalence in a population-based seroprevalence study of Cabarrus County. And you can see that our ILO group had a much higher antibody prevalence. And this was a different blood-based assay. This figure shows the same information, just the prevalence ratios of infection-induced and antibody results among ILO versus Cabarrus County. versus Atlanta healthcare worker and versus our ILO neighbor and our metro group. Then I'm going to talk about some of our questionnaire response data. This figure shows the dates when our participants report completing the primary COVID-19 vaccination series and then receiving at least one booster dose. And you can see there's somewhat of a lag with this green industrial livestock operation household participants potentially getting vaccinated later than other participants. And at the end of the study, it looked like our cohort had somewhat lower vaccination rates compared to North Carolina and the US as a whole. However, this might be an artifact of our long enrollment period. Some people who participated earlier might have become vaccinated after their participation. So we did follow up with as many participants as we could to ask about vaccination. But also I think it's useful to look at the proportion of our cohort who were vaccinated at the median call date, which is either the follow-up call date or the enrollment date if we were unable to reach them. And the proportion of the cohort who was vaccinated at that median date was closer to 51%, closer to North Carolina, 57%, and the US as a whole, 63%. The proportion of the cohort by study group was pretty similar. And then the pattern for participants who reported receiving at least one booster dose was similar. Then to understand workplace safety in industrial livestock operations, we plan to use a mixed methods explanatory sequential design. So first, our questionnaire had a subset of questions for industrial livestock operation workers and a little different for production and processing workers about work conditions, health and safety protections, and stress and mental health. And I've been looking at that questionnaire data and I want to use it to inform ongoing interviews. We're curious about vaccine requirements at work, health and safety protections at work, connections between work and symptoms, including stress and mental health, and then transitions to home and family. This is actually based on some previous work our group has done on how livestock-associated microbial contamination can spread into the community. And when we were thinking about designing the questionnaire, we looked at that non-legally binding OSHA guidance for the industry. And OSHA guidance and our questionnaire can be organized again into this hierarchy of controls from most to least protective. And I use the framework to try to organize by evaluation of workplace controls. Workers describe some limitations to this piece of the study are that even OSHA guidance has changed significantly over the pandemic. And I would especially note that what was going to be the emergency temporary standard, November 4, requiring that all companies with more than 100 workers require vaccination or weekly testing, and then that was struck down by the Supreme Court in January 2022. So we had 77 industrial livestock operation worker participants. We saw similar results to that Midwestern rapid response survey that most workplaces had some interventions, but that these were on the lower rung of the hierarchy of controls. Almost 90% of participants surveyed responded that masks were required. About 80% said that there were additional hand washing stations or hand sanitizer, but less than half said there was COVID testing available at the work site, and less than 20% reported any changes in workplace sick leave or bonus program policies. And this blue box really caught my attention because I would expect that to be one of the most effective ways to prevent the spread of COVID-19 and other infectious diseases. And I'd really like to learn more about how workers decide whether or not to go to work sick and what, I guess what can be done to prevent that and try to prevent the spread of infectious disease in these workplaces. So I want to ask more about that in the interviews. We also asked about stress and emotional well-being. As you might expect, many participants were worried about getting COVID, spreading the disease, as well as about medical bills and loss of income if they were to get sick. And this is also making me think more about attendance policies and how that can affect workplace safety and health and mental health. So we're conducting in-depth interviews with workers who participated in the study, calling them back and having a less structured conversation for about an hour about their experiences and thoughts on this topic. One of the themes coming out in the interview so far is difficulty workers have taking time off when ill. One person said, if I get sick with COVID, I show them proof. It won't count against me, but I don't get paid for it. Another worker described taking off one time. I was able to say I was sick and tell them I could not make it there till I got myself together. But I didn't do that much because I didn't have room for that. It's like a revolving door. Somebody else will be there. All 6 of the people I've talked with so far have mentioned points-based, so-called no-fault attendance policies, where you get a certain number of points for getting to work late or missing work, and you face escalating consequences with escalating numbers of points. This is something I'd really like to look into more. I found some information on how these policies often violate workers' rights, FMLA, that kind of thing. Because that seems like also a health hazard to me, potentially. And then here are some quotes related to other things coming up in the interviews that I thought were interesting. One participant said they're all about production. I learned that being there, that's what they're all about. It's about production. That really, a lot of people were talking about how, especially that the operation was more focused on the bottom line than on worker safety and health. Another person described the COVID informational video that the company showed new hires as it was just like a little short commercial-like video. It wasn't giving a bunch of information. And I thought that quote corresponded to what other people were saying about how the company was just trying to look good, seemed like. And then last participant said that after 90 days, they do offer work boots, but you have to get to your 90 days. And she was talking about kind of different workplace safety and health policies for that first 90 days that she was in compared to if you stayed past the 90 days. And that also seemed like potentially dangerous to me, especially because workers who are just starting out might not know as much about how to do their job safely. And I'd like to learn more about all of these themes and about what else comes up. And we're still recruiting participants. Livestock industry workplace hazards include animal waste and associated pollutants, including ammonia, hydrogen sulfide, volatile organic compounds, dust, animal dander, animal feed, viruses, fungi, bacteria, including antimicrobial resistant strains, bacterial endotoxins, cooling and cleaning chemicals in the processing industry, notably ammonia, chlorine, carbon monoxide, as well as equipment and machinery, noise, extreme temperatures, and infectious disease, COVID-19, zoonotic disease, and influenza, which I didn't talk about in this presentation, but there's evidence of influenza and potentially new strains of influenza from the animals. And I'd also like to note that workers are not exposed to just one of these hazards in isolation. And our group is planning to look at co-exposures to COVID-19 and some of these other microbial exposures as that piece of the work continues. I'd also say that the hierarchy of controls is a useful tool for risk assessment and for planning workplace safety and health interventions. And I think the case of COVID-19 and the livestock industry really underlines that better legislation and better enforcement is needed to protect worker safety and health in this industry. Related to COVID-19 and related to all of the other workplace hazards in this industry. I'd like to thank I'm supported by the NIOSH ERC Center at Johns Hopkins. The interviews I'm also doing with support from an ERC pilot project grant. The research as a whole is funded by the Grace Communications Foundation and these other sources. I'd like to thank Christini's group for all of the for support with all of the lab aspects of this, as well as Kirsten Kohler's group. She's my other advisor, and her students have also been helpful assisting me with this work. And also the REACH community organizers who recruited most of our participants, and then finally all of the study participants. Thank you. That's all I have, and I appreciate your attention and look forward to your questions. Michelle, should I stop sharing or keep it up?
It's up to you. You're welcome to stop sharing if you'd like.
Okay.
Awesome. Well, thank you so much for your presentation. At this time, you are more than welcome to ask questions in the Q&A box. If you're not familiar with Zoom, there is a little option in your menu of controls called Q&A, and you can enter your questions there. I do already have a bunch of questions that have come in throughout the presentation, so we will go ahead and get started here. Oh, well, first we'll do the non-questions, just some kudos. No question, but just wanted to say wonderful presentation and thank you.
Thank you.
Awesome. And also a kudos for following the OSHA guidelines and developing your questionnaire.
Thank you. I wanted to do that because I think, yeah, I think it could potentially be significant if we're showing that places aren't living up to the federal standard.
Great, thank you. And kind of on the idea of the OSHA guidance, are you able to speak at all to any familiarity you have with the state OSHA plans that might have some COVID-19 rules above and beyond the federal OSHA plans, and just if you encountered any differences between state and federal OSHA throughout your research?
That's a great question. I should have, I'm embarrassed to say I haven't looked at the North Carolina state standards, but I should. That's actually a good piece I should include in further work.
Yeah, for sure. Yeah, I know.
I suspect it's not going to be better.
Yeah, well, I know for folks in California, there are definitely some California OSHA rules in place, but I know that it was very hodgepodge throughout the country without that federal OSHA guidance. So thank you for that question from our listener. Another question, in meat plants, what is the difference between production and processing?
Yeah, thank you. This is a great question. I guess I use some overlapping terminology. By production, I mean breeding the animals, raising the animals. Each of those stages of feeding them and growing them up, and then processing would be slaughtering and packaging for sale. And I did separate that into those two categories. There's a lot of ways you could break down work in this industry, but I think those two categories make sense from an occupational health and safety perspective, because somebody working with the animals, feeding the animals, keeping them healthy, they're going to be exposed to a lot of hazards related to the animals, injury, zoonotic disease, that kind of thing. And they might be working maybe outside, more spread out, and have less risks related to like sharp tools and quick line speeds and crowding, whereas someone working in meat packing and processing is going to be working in an enclosed, large facility, most likely hundreds or thousands of people, with like sharp tools and quick line speeds. And so I think that makes sense as a way to break it down. I'm also interested in breaking down the information that we have by hog versus poultry, because I think there are probably some important differences.
Thank you so much for sharing. And are you able to share, you mentioned, quick processing speeds just
Yeah,
now, and I'm curious if you could just expand on that a little bit for folks who might be less familiar with just how fast those processing lines move, if you're able to shed any light.
yeah. I wish I had some the quotes from our interviews, because people were talking about that, including one woman who'd worked there for decades. She was talking about how it's yeah, it's getting worse, and they have these targets. Also, the person who was in her first 90 days of employment at a processing facility was talking about, like, she has these targets. If she can't make the target of I think it was the amount of particular kinds of chicken to pack, she would face consequences from her employer. I'm afraid to say something wrong, but I think I remember reading about actually an increase in the allowable processing speed during the pandemic, which is, I mean, not what you would want to protect worker safety. In fact, the opposite. And that's something else that actually also came out in the interviews. Before I started talking to people, I kind of had the idea that maybe during COVID, there'd be some occupational health interventions that would make other parts of the work safer, or anything that would make things COVID safer would make other infectious or airborne respiratory diseases safer, better ventilation, that kind of thing. But I actually heard the opposite from a few people, that when so many people were out in the processing workplaces, the company wasn't willing to slow down the line speed. And so it was even worse in terms of the musculoskeletal injuries. And one person I talked with attributed her injury to COVID-19 because she was working the same pace with 50% of the people.
Wow, thank you so much for sharing. Um, and also just for folks to know, we just uploaded a new webinar upcoming today that also gets into some health disparities in meat packing that'll happen in November. So while we're on the topic, I figured I'd share that with folks. We will have an upcoming webinar in November on health disparities in meat packing. I just got that information available today, so that's on our website.
And I hope they focus more on the musculoskeletal, because I know that's a really big health concern, and my research doesn't focus as much on that.
It is a part of our ergonomics series. So yes, they will be looking at some of the ergonomics and musculoskeletal. It's what triggered the thought. And they'll also be just looking at, it's a review of literature. So they'll be doing a summation of 60 different studies and what they found and what's known and unknown in meat packing. So these two webinars go very well together. I'm very excited you got to kick us off. I'm also curious, just in the course of your interviews, was there anything else that just really stood out to you as something you didn't expect, or something that, was better or worse than what you anticipated it would be? Anything you were really surprised by that you'd be willing to share with us today?
Something else that I like came out, a few people talked about their individual supervisor as being a big factor in how they felt about their work, and even safety and health in their workplace. One of the production workers, processing workers, spoke really highly of her supervisor, that she was like helping put her like higher up on the line so that she was able to work a little more quickly as she was starting out. Yeah, just that I guess, like anywhere, good and bad managers make a difference.
Yeah, absolutely. The importance of good management cannot be understated. Some more questions from our audience here. Do you happen to know, is North Carolina a right to work state or an employment at will state?
Oh, I'm sorry. Again, I need to check this. I
Okay.
I think it's a right to work state, but I'm not sure. Wait, do you know, Michelle?
I don't, but that is okay.
If anyone
Thank you
else,
for the
if anyone else
question.
yeah, thank you for the question. Let me make a note.
Awesome.
Oh, and also my research group does have some connections with unions in the area that we need to follow up on more. And we were thinking of trying to use that as a way to recruit participants. We haven't really so far. I actually kind of dropped the ball on that. I should follow up with those people as well. Uh,
Awesome. Well, thank you for the questions and the feedback. Um,
yeah.
yeah, that's awesome. We have some more questions here. You mentioned that 87% of those infected were minorities and 13% were white. Does this indicate that a difference in the populations that work in these facilities, a difference in exposures, does it follow non-occupational demographics in the areas in which people are being exposed, or was this mostly tied to occupation? Anything that you're able to share on that would be interesting.
Yeah, so I think, thank you for the question. Any infectious disease, I mean, I'm sure you all have personal experiences with this as well. Like there's no way to know exactly where you got the disease. I think that study that I cited, as well as my work, is sort of saying like both of those things are true. Like racial and ethnic minorities in the US face a higher COVID risk for a variety of reasons. Structural racism in a variety of manifestations. One thing I've read about is like overcrowded housing is a risk factor that I think like makes sense as biologically plausible, increasing the spread of disease. But I think, I mean, your work is where you spend 40, 50, 60 hours a week. I think it's it's hard to argue that your occupation isn't a big factor in exposing you to COVID. And especially, I think, for meatpacking workers who are right next to each other on the line, long days, few breaks, with limited information from the company. That's something else that came out in the interviews, like not knowing if the person next to you like tested positive, very little information from the company. I mean, I think the meatpacking workforce is disproportionately racial and ethnic minorities, again, like because of various structural factors. And then I think occupation is, and then also occupation is probably part of the reason for COVID disparities by race ethnicity. But then what I also wanted to call out with that statistic was that even within the meatpacking workforce, for example, a disproportionate number of the cases were racial and ethnic minorities. And I think, sorry, I don't know where I was going with this.
Yeah, no, I'd say you definitely.
Good question. I think there's a lot going on. I think work is part of the reason for health disparities.
Awesome, thank you. Yeah, and actually for our listeners, we had a wonderful series with Mike Flynn, who works at NIOSH, that looks at occupational health equity and specifically how occupation is tied to health inequities and the importance of your occupation to your overall health and well-being. Those webinars are also recorded on our YouTube page where this one will end up. And also, I'll just add too that in California, we saw similar amongst our agricultural workers, especially when housing was being shared or there was carpooling, just the different demographics of, you know, where people are staying, living when you're out in the fields working, and just how there's a lot of shared housing and a lot of exposure amongst agricultural workers here in California. Some additional questions. You kind of started to talk about this in your previous answer, but just kind of a comment, and feel free if you want to add any other thoughts. The chart on stress and worry would seem to reflect a lack of training on the significant risk, hazards, and mitigation methods by companies. Is there anything you'd like to kind of add to that thought? Just regarding, you know, the training, awareness, et cetera, that you found in your interviews.
I don't think so. I mean, I guess just that I feel like companies should provide more information and better policies for worker health, especially during COVID.
Yeah, absolutely. And what are the main CDC guidelines or references or regulations to follow aligned with OSHA regulations?
I mean, I would have to check the latest thing. I don't want to say the wrong thing, but I'd imagine they're pretty closely aligned. Get vaccinated, get boosted, wear a mask when you're indoors in a potential high transmission setting.
Absolutely. And I'll add too, if this person happens to be in California, Cal OSHA does have specific regulations around COVID-19. They have been getting updated quite a lot. So I'd recommend you check out the Cal OSHA website or also the CDC website. And to find the latest guidance. All of those things they all have really nice COVID-19 dashboards on their websites by now with the latest and greatest for regulations, guidance, protections, etc.
I guess that's something I would actually want to add to my takeaway of I think there needs to be better legislation, better enforcement. I think also I wish these agencies were doing a better job of sharing information with workers and the public at large. That I'm studying this for my PhD and I don't know the latest. I mean, part of that's on me, but also
Yeah, just the
I
public
guess
awareness campaigns.
health communication, yeah, awareness campaigns.
Do you know if the North Carolina Health Departments did any contact tracing?
I'm sure they did. I don't think I have any. I don't think I have access to the data. The North Carolina Health Department, a connection of the North Carolina Health Department is how we made our connection with that Cabarrus County General Population Survey. They're involved in a consortium of researchers doing serology research, and that's more what I've been trying to get other information on.
Great, thank you.
Our study was so cross-sectional and also such a long enrollment period. Again, I mean, just because of our difficulty recruiting participants, that like we can't really look at like individual transmission. I feel like that's different research questions than we focused on, but that's a good question.
Sure. Yeah, and actually, can you speak a little bit more on your recruitment? What were some of the, I guess, the biggest challenges that you faced in finding study participants? Was there like any hesitation from workers to be involved in your study? You know, fear of retaliation or anything like that? Or were folks like, no, I want to talk to you, talk to me, let's go into this?
So I think there is some fear of retaliation from employers, and we did a lot of the study to try and protect people's confidentiality. But I don't know. I think also part of the reason we had some difficulty recruiting participants was the remote nature of the study early on. In the past, we've done like, well, I guess I wasn't a student then, so I'm not sure, but I've heard from other members of the group that we've done like bigger community events, things at churches, like, yeah, like providing information, things that people want to come to, and then been able to recruit participants or have people participate in a way that's more engaging and easier for them than sitting on a Zoom.
Thank you. Yeah. And I guess the last question in here, I think you've already kind of answered, but we'll just reiterate. As far as policies that allow workers to miss work, will you be asking what factors influence their decision? For example, critically needing the money, we're told that they'd be fired, peer pressure. Is that something that was kind of further extrapolated on in the interviews and as you're reviewing some of that information?
That's a great question. And that's exactly what I want to try and do with the interviews. And Dee, I really wish we could go back to our questionnaire and include some more information on that. I think those are all such important questions for making policy recommendations or making workplace health and safety policy recommendation, like company policy recommendations to try and keep people from coming to work sick. And
well, thank you so much for sharing your data with us, for sharing your research with us. Please do feel free to keep in touch. And if you have any publications that you want to share with the group, you can send them my way and we'll make sure they get out to folks. A special thank you to everyone who joined us today and to you, Carolyn, for presenting and for doing this very important research in the first place. So thank you for that. I'm going to go ahead and pop the evaluation link in the chat for folks who want to take the evaluation now. You can now do so in the chat. And be sure to check out our website for other upcoming webinars. As I mentioned, we're going to have an ergonomics themed health disparities in meatpacking webinar that was just launched as of today. We got details for that coming up in November. So you can learn more about that at Berkeley, COEH at berkeley.edu/about CE. And thank you so much again for this excellent talk today.
Thank you. I really appreciate it. Actually, I have a question, I guess, for the group. If any of you have done work on points-based, no-fault attendance systems and health, I would love to connect and learn more about anything you've found or done.
Awesome. Yes. So please, if you would like a connection, if you have experience, would you say point space?
Yeah, I think that might be important, and I'd like to learn more about it. I've
Yeah,
enjoyed the
absolutely.
conversation.
So feel free to reach out to us and we can connect you. That would be great. Thank you all so much. Bye.